Hello again. Welcome back to my channel. I thought that today I'd talk about how vision develops from birth, why it develops in the way that it does, how it's integrated with the development of movement, and why this is important. I'm going to assume, for the purposes of this video, that the baby has vision which is developing normally, that they're not short-sighted, which we call myopia, or long-sighted, which we call hyperopia, and that the eyes are physically healthy. I will, however, mention one condition called infantile esotropia, because that's a condition which develops within the very specific time frame I'm discussing today. Okay, so you might have heard sayings like, at least 70% of the information we take in about the world comes through our eyes, or at least 30 different areas of the brain are involved in vision, or 50% of the brain is devoted to vision. It's actually 50% of the cortex of the brain, but that's still about 40% of the whole brain, so quite a lot. What we can take from these declarations is that we human beings are a very visual species. Now, I had two babies. The oldest is currently 22, and I remember being quite shocked that neither the antenatal nor the postnatal classes I attended touched on vision. They covered the birth, feeding, weight gain, sleeping, bathing, teething, bonding, skin care, vaccinations, but nothing about vision. I've spoken to some of my own patients who've become mothers very recently, and they said it's still the same today. I mean, given how important vision is to a baby's development, I do find this omission really odd. But back to our imaginary baby. Vision, as we experience it as adults, is not something that we're born with. Vision is actually a learned skill, much like language, and most parents are quite surprised when they hear that. Think about a babbling baby. They make sounds like ba ba ba, ba ba ba. It's cute, but it's completely nonsensical. And when babies babble, the sounds they make are random. And as doting parents, we're delighted and we endlessly repeat those sounds back to them. Over time, the baby begins to link the sounds they make to those they hear repeated back to them. It's no accident that babies' first words are often mama or dada. These words emerge directly from the ma 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 and da 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 sounds that all babies make. By repetition and positive reinforcement, babies gradually realize that these sounds have meaning and that they're capable of making more sounds with meaning, which develop into sentences and eventually evolve into language. Well, vision follows a similar development pattern, though most of us don't realize it. We've already established that we humans are primarily a visual species, yet at birth, vision is actually the least developed of our senses. A newborn's world is blurry. They can't see more than about 20 to 30 centimetres away from their faces, which, if you think about it, is the ideal distance to be able to see mom's face or dad's while being fed or held. Most parental interactions with their babies are naturally in very close proximity. Babies don't even have much in the way of colour vision at this stage, which is why they're attracted to high contrast patterns like black and white stripes or squares. You might have noticed that a baby will stare intently at a window covered with slatted blinds or at dark moving shadows on a light coloured surface. You can see from the shadows here that this baby is staring directly at the pattern that the blinds are making. If you watch a baby's eye movements in the early days following their birth, the movements seem jerky, random, uncoordinated, and it can look as though one or both of their eyes occasionally drift in towards their nose. By around 8 weeks old, their vision has become a little bit more established, and at this point, babies begin to develop visual attention, which is the ability to pay attention selectively. They begin to become fascinated by faces, and they scrutinize the faces of anyone near to them or their own in a mirror. And they also begin to respond to colour, particularly bright colours. Their eye movements also gradually become smoother, and they begin to show signs of being able to track moving objects. If you move a toy around above them, their eyes will follow the path that it takes. At this stage, they're especially sensitive to an emotion in the periphery of their vision. Any mother who's been quietly nursing will know what happens when something suddenly catches baby's attention in their peripheral vision. the infant whips its head round to see what's happening and usually doesn't bother to unlatch first, with predictable consequences for poor mum. Then at between 3 to 4 months, the baby's brain begins to become aware of the fact that there are two eyes and that information being captured by the right eye is slightly different to that being captured by the left. If you want to experience this for yourself, just hold your finger out in front of you and look at it and close one eye and then the other eye, and you'll see that your finger will appear to jump from side to side because of the slightly different position of the eyes in your head. So, having worked out that there are two sources of visual information, baby's brain quickly learns to compare the differences between these two sources, and it uses the combined information in a process called binocular fusion. And so depth perception starts to emerge, and the baby begins to appreciate the world in 3 dimensions. At this point, I'll take a moment to flag up a problem that some parents notice around this time. In some infants, one or both of the eyes will begin to turn obviously inwards towards the nose. And this is a condition called infantile esotropia, and it affects roughly 1 in about 12,500 babies. The exact cause of infantile esotropia is not fully understood. It may be due to a problem with how the brain and the eye muscles work together. The brain may have difficulty coordinating both eyes to work as a pair, which leads to one or both eyes turning inwards instead of pointing in the same direction. And it could be that it occurs as a response to vision not developing normally in the first weeks of life, and the eyes gradually turn inwards as the brain responds and adapts to the poor vision. There's even some work suggesting that it's due to problems in the motion processing pathways in the brain, but in all likelihood, it is probably some combination of all of these explanations. Unlike some other eye turns, infantile esotropia is not usually caused by large amounts of long-sightedness, which we call hyperopia, and is therefore not correctable with glasses. It can run in families. It can be related to prematurity, low birth weight, hydrocephalus, cerebral palsy, developmental delays or seizures. So this is completely different to the transient newborn thing I mentioned earlier, where the eyes sometimes drift inwards because they're not yet fully coordinated. Infantile esotropia doesn't go away on its own. It requires early intervention, usually surgery before the age of 2, to prevent permanently impaired vision and problems with spatial awareness. So back to our original baby. At 4 to 6 months old, babies usually start reaching for things purposefully. They will look at an object, and if they're interested in it and they want it, they'll reach for it. If they miss, they'll try again repeatedly. And this is a really interesting stage because this is when vision development starts to drive motor development. Babies actually begin to use their eyes to guide their hands, and suddenly vision isn't passive anymore. It's now actually directing their behaviour. And if they can't grab what they're interested in, they can become very frustrated. They're absolutely driven to reach out and bring things towards them so they can explore them visually, tactilely, orally. If a baby isn't reaching for things at this age, it's a huge developmental red flag. So baby's eyesight, what we call visual acuity, has improved a lot by this stage. They should be able to recognise familiar faces, the dog, their favourite toy from across a room. And from the moment that this baby began to lift their own head, roll over and sit up, their brains started to link their vision with their posture and also their position in space. So now when something catches their attention, their brain tells them to turn their head and their eyes to point towards it. This is the age they begin to work out what an item is and also where they are in relation to it. Their head, body and eyes all begin to work together as the visual system learns where to look and how to hold or sustain their gaze on an object of interest. Now they begin to coordinate their limbs deliberately and bring their hands together in front of them at the midline, which is the invisible vertical line that divides our body into two. And then they begin to push themselves up off the ground, balancing on their forearms and their hands. And their little legs begin to coordinate too. And sometimes at this stage, they begin to commando crawl. So my youngest son did this, and he would motor across our polished wooden floors at speed until he encountered a rug, and friction would bring his progress to an abrupt halt. Eventually, though, he, like other babies, managed to push himself up onto his knees, and at about 7 to 9 months, he began to crawl. So once babies can crawl, they're free to move towards anything that interests them, though a lot of babies, to their immense surprise, move backwards first, away from the object of interest. Gradually, though, through trial and error, their spatial awareness and coordination begin to build. And this is when we parents discover that our tiny offspring's drive to investigate any item is usually directly proportional to how dangerous it is. This is the age of baby-proofing everything. Parents they tend to think of crawling as a developmental milestone, something to just tick off at the health visitor appointment to prove that our baby is developing normally. But now we can see that it actually doesn't happen just because a baby happens to reach 7 to 9 months. Crawling emerges as a direct result of a baby wanting something out of arm's reach, in this case, mom and dad. Crawling is in fact a goal-driven behaviour underpinned by vision. And crawling is important for many reasons. When babies crawl, they learn how to coordinate the right side of their body with the left side. They develop proprioceptive skills through weight bearing on their hands, and they learn about visual space, which objects are near to them and which are further away. They learn how to team their eyes to point them at an object of interest, and they learn how to focus on that object. They can also learn to place objects centrally within their visual field. You can see this little chap's attention is on the green toy. He's turned his head and his eyes towards it, and he's placed it slap bang in the middle of his visual field. And you can also see how his eyes are teaming so that they're both pointing at it. Any baby that repeatedly looks at the world sort of off to one side needs their vision properly investigated. So as a baby moves towards any object, they learn to adjust both their eye teaming and their eye focusing to keep it clear as they get closer, and make adjustments in their trajectory to keep it central in their visual field. Finally, all of these systems, posture, balance, and vision, begin to integrate. So you can hopefully understand that the ability to coordinate eye teaming, which we call convergence, and focusing, which we call accommodation, at the same point in space is not an automatic skill. It's actually learned through repeated movement and interaction with the world around them. That seems like a good place to stop today, but as we'll see in the next video, it turns out that movement is very important indeed in the further development of vision. Thanks for listening. I hope you enjoyed this video. Bye for now.